with the questions. Can't you just let me die in peace?
Just answer me this. You say that you don't want any visitors, but according to your chart, you're pretty much alone in the world. So I'm just curious, who is it that you are hoping not to see?
Freeze. Stop it.
Freeze?
What?
You said freeze. Please? Did you mean to say please stop it?
No.
Keith, you've been having a hard time mispronouncing words, repeating words.
No.
You know, you seem a little agitated. Why don't we get rid of these for now?
No, I'm okay.
No, I just want to give you a little break.
No, freeze, stop it.
We'll get a little spasmy. Keith, that's not a muscle spasm. It's chorea. You have Huntington's disease, don't you?
They say it only gets worse from here. Got enough reason to want to kill myself.
Dr. Becker? I heard you were treating my father, Keith Yates.
I'm sorry, how did you say you were related?
I'm his son, Max. This is my fiancée, Elodie. We literally just arrived from the airport.
You're his son?
Yes. His neighbor said she heard something about a car crash. I've been calling hospitals. They say he was here.
I'm sorry, Max, your father was in an accident. He's stable now, but have you been in contact with your father?
We email, we talk on the phone. I haven't seen him in a couple of years. I've been away at culinary school in France. I need to see him. I need to see him now.
I'm sorry, Max, your father's made it clear he doesn't want any visitors.
But I'm his son. This is insane. I just spoke with my father yesterday. He knew we were flying home today.
Qu'est-ce qui se passe?
Mon père est ici. Il a eu un accident stable. Monsieur, doctor...
I'm sorry, I have to go.
Doctor, please, you need to help me figure out what's going on here.
I'll do what I can.
The stats are dropping. Down to 87 now.
Chest tube must have clotted off. Your son is here in the hospital. He wants to see you.
No.
That's why you crashed your car, isn't it? You wanted to die before your son could find out.
Stats 85. 84.
I can't strip it. Lidocaine, please.
What are you doing?
I'm placing a second tube.
Patient has a DNR and a DNI.
That does not mean do not treat.
Dr. Becker, for God's sake, let him go.
Scalpel. Well, stats are back up. At least he's breathing again.
What the hell are you thinking?
You wondered who it was Keith didn't want to come and visit? It was his son, Max. Yeah, he's in the surgical waiting area right now.
He's here?
Yeah. That young man has a 50-50 chance of inheriting a fatal disease, and he needs to be tested. We need to convince Keith to tell him so that can happen.
Yeah, but what if we can't convince him? We can't keep him alive indefinitely.
Well, then we need to tell Max ourselves. It'd be morally negligent if we didn't.
Divulging a patient's confidential medical information is a federal offense.
Not long from now, I'm going to be sitting across from Max as he asks me why his father died, and all I'm going to be able to do is shrug.
You were called in just to...
You're still here?
Well, if you're not going to let your son sit vigil, I'm afraid you're stuck with me. Although I really wish you'd rethink your position. Keith, Max needs to know about your condition so he can be tested.
No.
You don't think he has the right to know?
Max has already been tested. When I was diagnosed, I took him in secretly. My ex-wife never knew. Max was 7. I hoped the news would be good.
And it wasn't?
Max is 25. I was his age when I found out I had it. I lost my purpose in life. It all seemed so pointless. I don't want that for my son.
How's he doing?
BP's 80/43.
10 of morphine.
Listen, Keith, you don't know how he's going to react. He might surprise you. And medicine is advancing so rapidly, Keith, that there could be a cure by the time he contracts the disease.
Sir, you can't go in there. No visitors allowed.
That's my father. Dad, it's me, Max. Max, what's happening?
So you're not supposed to be in here.
72/30.
Go do something. He can't breathe.
He asked not to be intubated, Max.
Dad, please listen to me. I proposed to a girl at school and she said yes. Okay, her name is Elodie. I know you'll like her. She's just outside now. I want you to meet her. Just please let the doctor save you. Is anyone gonna do anything? Bring him back. Bring him back.
Time of death 1913. So sorry. Do you need any help finding a mortuary after the ME releases his body?
I already contacted one.
I realize it was frustrating being refused access like you were.
You know, he also stipulated that his medical records be sealed for the next 50 years. 50 years? What was he so afraid of me finding out? I love my dad. I did. I always felt like he was hiding something from me. I'm not gonna be that way with my kids. I don't even know how my father died.
Are you aware, Max, that you can ask the medical examiner to perform an autopsy? As an next of kin, you have that right, doesn't he, Dr. Becker?
Yes, he does.
Yeah. You never know, you might get a couple answers to some of those questions you have.
Maybe I will. Thank you.
An autopsy? That'll tell Max the truth.
He's planning on having children. He needs to know the risk. Despite Keith's good intentions, I don't know. Maybe some secrets you just don't get to keep.